I have a special guest. I hope you're streaming spicefm.c live. Welcome to the show. Karibu Sana. Good to have you here on our show. We've got a lot of conversations to have, and it's all about that pain. The pain that just won't go away and you don't know what to do with it. Welcome. Welcome to the show.
Thank you for having me. It's an honor to be invited to your drive show.
Fantastic. Thank you for making time out of your busy schedule. I'm sure it is hectic. A lot of people are working from home, suffering from back pain and things like that, stuff that we don't understand, and where to get the right care and where to get that professional advice about it. This is where we have you as an expert, as a therapist, to come here and join us. Shout out to everyone on the timeline sharing feedback and asking questions. Give us a brief background on who you are, where this all began, your skill set, and the business that you're in.
Yeah, so graduated in my profession in 2013 in the UK.
Yeah.
Qualified here in 2013 and been working in Nairobi since 2015.
Nice.
Currently working at Surrey Center, where my clinic is, and it's called Pain Matters Consultancy. I just an amazing profession to be in, just to see how we can help people change their lives overnight, so to speak. People come in with pain, and more often than not, they leave the clinic within 45 minutes feeling a lot better, with renewed hope, excitement, so that they can enjoy life again and not let the pain disturb it.
Wow, that's a special job. You're talking about 5 minutes of a lifestyle change after getting the right reviews and, a doctor seeing you. Tell us about osteopathy and this work you do, this brilliant work.
So osteopathy is a form of manual therapy, looking to find out the underlying cause of your pain and discomfort. Osteopathy is over 150 years old. It actually started in the US and now it's worldwide. It looks at the whole person, not just the pain that they've come in. A lot of times, classic example is people suffering from back pain often realize that there's a psychological element to it. They're stressed at work, stressed at home, financial, marital, all sorts of issues, which can lead to physical pain. So pain is not just physical, there's a psychosomatic element to it. So osteopathy aims to address all those issues that potentially are causing their discomfort, aches and pains.
Wow, it's profound to speak of, the emotional and physical pain and the connection between that and how you uncover this. What is the educational training of an osteopath? There are probably a lot of people listening in trying to understand this work you do.
Yeah, so I'll give you my route. So I did the A levels, the British system, and then from there went into university. It's a 4-year degree where you cover anatomy, biomechanics, you cover physiology, you cover pharmacology, to a certain extent, nutrition, and it's a 4-year master's degree in the UK. US is slightly different, but in Europe, generally, it's a 4-year degree as an undergraduate.
Wow.
Yes.
There's conditions that you treat, and you have a lot of people visiting your office, and from time to time they come back with the same things. Different people, different ages, different lifestyles. What are some of the conditions that you treat?
So one of the most common conditions is back pain, whether that's neck pain or lower back pain. That is one of the most common conditions. And in that, anything from sciatica to entrapped nerve is one of the most common. And then more and more so headaches, because people are on their phones 24/7, on the laptops. So that creating that kind of tension headaches, that's something that's really propped up. And more so in youngsters now, knee pains, hip pain, just because they're no longer as active as they used to be. So the chair has kind of created this dysfunction in the way the human body works. So more knee pain, more lower back pain, neck pain, shoulder pain kind of situations arising. Yeah.
Wow. So it must be crucial to understand a client's medical history and their lifestyles as well. Take us through the process.
Correct. So For example, if you come in complaining of neck pain,
Mm.
I'll ask you when the pain started, how it started, what triggered it off. Was there an incident? Was it a gradual buildup of the aches and pains? And then I'll ask you any associated symptoms with that. So when it's with neck pain, I'll ask you if there's any headaches, any double vision, blurry vision, any kind of dizziness associated with it, any difficulty swallowing your food,
Mm.
any kind of pain down the arm, the shoulder, any numbness, any tingling, any burning sensation, any breathing difficulties, all those kind of questions, just to understand what exactly is causing the neck pain.
Mm.
And the key to this is to understand and to make sure that it's a purely musculoskeletal issue, nothing more sinister.
Mm.
Example, if you have lung tumors and something called a pancreas tumor, which is at the apex of the lung,
Right.
that can present with neck pain, shoulder pain, numbness down the arms, which are very similar to neurological kind of symptoms associated with an impinged nerve in the neck.
Mm.
However, the pain characteristics, the type of pain, the duration, the triggers, the alleviators are very different. So the aim of the consultation is just to make sure that you're safe to be treated. There's nothing sinister going on.
Wow, you go in
Yeah.
and out with every single detail. A lot of people are suffering quietly and they don't know where to go and how to seek help. Take us through how to visit your office and what we need for the first appointment. I can't wait.
So basically, you just call my number
Mm.
0700099944,
Yeah.
and you book in an appointment. The initial appointment is approximately an hour,
Mm.
where I go through a medical history, I do a physical examination, and then from there decide whether you're safe to be treated and whether there's something I can help with. As a patient, you come in. If you have any medical documentation that you've done in the past, such as blood tests or scans, MRIs, X-rays, anything of the sort,
Mm.
you can bring them along. And yeah, that's about it. Wear comfortable clothing,
Yes.
because you may be asked to undress down to your underclothes just to assess the area.
Mm.
So if it's your neck and shoulder, we'll ask you to remove your top, so you're left with, in women's cases, with their bra.
Mm.
So just make sure you wear comfortable, appropriate clothing, because you want to be assessing the area, the skin color, the texture, pigmentation, because all these are signs of potential conditions that may need further addressing or further referrals.
Great, great stuff right there.
Yes.
So, there's people who have been struggling with issues they do not know much about, and they probably run to Google for information, and they search for their own, remedies and try to see how they can help themselves at home. What are some of the ways we can prevent orthopedic issues? There's people who struggle with back pain, like myself. I sit for a couple of hours in here. You mentioned neck pain, and also mothers, who have pains that they can't describe. What are some of the things we can do when it comes to lifestyle changes? What are some of the tips you can give us for everyone listening in on to the Spice Drive?
Um, so even more so since COVID has affected us, a lot of us are working from home. Kids are now studying from home. So general activity levels have gone down. When kids go to school, yes, they're in class for a certain hours, but because they have regular breaks and they're running around, they're sitting, they don't become sedentary. Whereas
Mm.
now when they're at home, they're just on Zoom. So I mean, they're already playing lots of computer games on the iPads, on the iPhones.
Mm.
Now you've added another layer of technology in them, because now they have to learn through Zoom. So they're sitting more and more, and hence you see a lot of kids now suffering from neck issues, lower back issues. Adults now, we're working from home, so our traveling times have gone. So instead of being active, walking to work or just traveling, we are now more seated again. So sedentary lifestyle is one of the biggest issues we face in the 21st century.
Mm.
The human body is like a machine. If you don't use it, you lose it. You look at you speak to anyone, they'll know that if you don't use a car or a piece of equipment, it'll rust over time. It'll become stiff. It'll become rusty. And the only way to fix it is to grease it, move it, and just keep it going, keep the machines running. Same with the human body.
Mm.
If you're sat all day long, you're going to have all sorts of issues. So
Right.
the best advice I give people is remain active, keep moving, little but often.
There's a special
Yeah.
group of people, and I'm going to be wrapping up with this question, and it's all about the moms and how our bodies transform. There's women who report body changes even 2 years after having a child, or 3 years, 5 years, because there's something that was unchecked. And I think the best advice for moms is hang in there. That's how a woman's body feels like. So, what have you experienced when it comes to pregnancy and women, and the care you give before and after this experience? How does that
So
work?
one of the so one of the things that women who are pregnant are scared of is movement and training, working out. I think there's this misguided information saying that if you're pregnant, you can't work out. You're supposed to rest. You're not supposed to do anything strenuous. Unless there's an underlying medical condition, I do not see why women who are pregnant can not work out. Yes, the workouts will change. The way they can push the bodies will change. The demands will reduce in terms of if you're squatting, let's say 80 kilos
Right.
through pregnancy, they may have to reduce that load because the body cannot handle it. But it's not to say they stop squatting. Even after pregnancy, the first 6 weeks post pregnancy is crucial, where they need to rest and not do too much activity. But after, they can resume their normal workouts and all that. Um, the body will change. Your posture will change through pregnancy, because now your belly is going to grow. You're kind of carrying another person in you, so your force distribution through your body will change. So you're going to put a lot of pressure through your lower back, your hips. So of course you're going to get aches and pains, but that does not mean that you have to live with it. You can go see a therapist, get that addressed, get them giving you exercise how to manage that, get the soft tissue released because the muscles are overworking. There are other parts of the body that can be manipulated to ease the pressure through the lower back. And then post pregnancy, you're breastfeeding. Your positionings of mothers in relation to the child is also very strenuous. A lot of the times they don't have the right posture. They're not educated that this is how you do it. Mothers will go above and beyond to feed their child without even looking after themselves. So I think just getting the mothers to be given the right information, educating them on how they can breastfeed effectively whilst looking after themselves,
Yeah.
and also ensuring their baby can feed properly. Um, if the mothers have had C-sections, how to recover from that, how to give them the right exercises to reduce the incontinence, because a lot of mothers suffer from incontinence. And as a result, they're shy to go out because they're ashamed that, or if they can't control the bladder. So an emotional element, a psychological element creeps in because now mothers will not go out, and it's a very stressful time. So getting the right help, seeing an osteopath, seeing somebody who works with pelvic floor disorders is very important to allow the mothers to go back to normal life even after pregnancy. So
Yeah.
there's a lot. So mothers, my advice to you is if you're unsure, just reach out. There are ways to make sure that you're not suffering in silence.
And I've seen a lot of
Yes,
comments about sports injuries as well. You have a variety of clients and different needs and different conditions that you cater to. So, how can we follow you online, and how can people get in touch to make sure that they get seen about the conditions that they're dealing with? And you know, you have your office at the Sarit Center.
correct.
Yes.
So, as I mentioned earlier in the program, just give a shout out for me,
Yeah.
book an appointment. I have a website called painmatters.co.ke.
Yeah.
Just come, just go on my website. There's a lot of information in there, and if you want any more, you can email me on info@painmatters.co.ke, or just call me on 0700099944, and we can find a positive way forward, whether it's through me or to somebody else. We will find a way forward.
All right. Just to remind everybody, the website is painmatters.co.ke, and questions at
Correct.
info@painmatters.co.ke. Right?
Correct.
Yes. And of
Correct.
course, we're going to be sharing more details on our social media. So many questions. Some of them come off a little personal to me as well, because there's a lot of questions, too much information online, but we need to filter it and get expert advice and all the information. It's available. Thank you. Great work you do, changing lives in 5 minutes, as you said. So, of course, we're going
Thank
to
you.
be.
Thank you.
Thank you. Thank you so very much. We're going to be in touch on social media, and we're going to be connecting you so that you can get, whatever that pain is. We have to make sure that you get it checked.